House will stop declaring emergencies under COVID-19 on May 11th. On May 11th, the White House will lift a pair of COVID-19 emergency designations, the newest indication that the administration is reducing its efforts to combat the virus. The administration stated on Monday in a statement of policy on bills relating to the measures that the national emergency and public health emergency will be prolonged until that date and then lifted. The action marks a turning point in the coronavirus response, which dominated many of the first few weeks of President Joe Biden's presidency. In response to two Republican House of Representatives proposals that would end the public health emergency and the national emergency, the White House issued a statement of administration policy. The measures wind down in May would give states more time to prepare for the changes, according to the Biden administration, which stated that it seriously opposes their passage. The U.S. pandemic response has progressively faded into the background, notwithstanding the limited uptake of the most recent booster dose. According to data from the Centers for Disease Control and Prevention, almost 500 individuals die with COVID every day. The World Health Organization earlier on Monday stated that the status of the global health emergency had not changed. Following a meeting of the COVID-19 Emergency Committee on Friday, the United Nations agency announced its decision. The WHO's Tedros Adhanom Ghebreyesus expressed his continued optimism that in the upcoming year, the world will move to a new phase. Continual extensions. Since the initial COVID public health emergency designation by the Trump administration in January 2020, actions that have increased access to health care for millions of Americans have been maintained by the U.S. Department of Health and Human Services through mid-April. In a statement released on Monday, the Biden administration announced that the public health emergency will now last until May 11th. Further comments were rejected by the White House. Requests for comment from the Department of Health and Human Services were not immediately fulfilled. In order to give states enough time to prepare for changes to programs and regulatory powers, the Biden administration has committed to giving states 60 days notice before declaring the public health emergency over. The emergency declaration established flexible access to telehealth services and gave millions of Americans exceptional access to Medicaid, a state and federal program that offers health coverage to low-income people. And quick end to the emergency designations, according to the administration, would create widespread turmoil and confusion throughout the healthcare system. Due to the public health emergency, Medicaid was able to maintain patients enrolled during the duration of the special designation. As a result, compared to pre-pandemic levels, Medicaid enrollment has dramatically grown. The continuous enrollment clause was repealed by Congress at the end of March, according to the funding bill it passed for the year. According to the Kaiser Family Foundation, if the provision is eliminated, 5 million to 14 million people might lose their Medicaid coverage. Republicans in Congress have long requested that the Biden administration put a stop to the public health emergency because they view it as an excessively intrusive form of government action. Health Department must establish protections for vulnerable individuals before lifting the emergency designation, especially during the winter when the danger of coronavirus transmission increases and places a strain on the health system, according to health policy experts who supported the classification. That's the info this time. Don't forget to subscribe, like, and comment so that this channel can continue to exist. Thank you for listening to the end and I hope it's useful.